Hey there and welcome back to KADD'S Health Corner. Today we're diving into a topic that can save lives: cervical cancer. Did you know that this type of cancer is both preventable and treatable when caught early? Yet it remains one of the leading causes of cancer-related deaths in women worldwide. Don't worry, we're here to break it all down for you in simple terms: what it is, early signs and symptoms, stages, how to prevent it, and how tools like pap smears and the HPV vaccine play a crucial role. So, grab a cup of tea and stick around because this information could make all the difference for you or someone you love. First off, what exactly is cervical cancer? Your cervix is the lower part of the uterus that connects to the vagina. Cervical cancer occurs when abnormal cells on the cervix grow uncontrollably. Most cases are caused by a common virus called human papillomavirus, or HPV. We'll get into HPV a bit more later. Here's a staggering fact. According to the World Health Organization, over 600,000 women are diagnosed with cervical cancer each year, and more than 300,000 lose their lives to it. However, there's good news. Cervical cancer is highly preventable and treatable if caught early. Early stages of cervical cancer often don't show symptoms, which is why regular screening is so important. However, some early signs to watch for include unusual vaginal bleeding, such as bleeding between periods, after sex, or after menopause. Persistent pelvic pain that isn't related to your menstrual cycle. Unusual vaginal discharge that may be watery, pink, or foul-smelling. Pain during intercourse. If you notice any of these symptoms, don't ignore them. Consult your doctor immediately. It's also important to understand the stages of cervical cancer. These stages help doctors determine the best course of treatment. Stage 0, also called carcinoma in situ, where abnormal cells are found only in the surface layer of the cervix. Stage 1. Cancer is confined to the cervix and hasn't spread to nearby tissues. Stage 2. Cancer has spread beyond the cervix but hasn't reached the walls of the pelvis or the lower part of the vagina. Stage 3. Cancer has spread to the lower part of the vagina, pelvic walls, or nearby lymph nodes. Stage 4. The most advanced stage, where cancer has spread to other parts of the body such as the bladder, rectum, or distant organs like the lungs or liver. Understanding these stages emphasizes the importance of early detection and intervention. Prevention is your best defense against cervical cancer. One of the most effective tools we have is the pap smear, a simple test that checks for abnormal cells in the cervix. Starting at age 21, it's recommended that women get pap smears every 3 years, or as advised by their doctor. If you're over 30, you can combine it with an HPV test for even better screening. It might feel a little uncomfortable, but trust me, it's quick and can literally save your life. Regular screenings can detect changes in cervical cells long before they turn into cancer, giving you the chance to take action early. In addition to screenings, lifestyle factors can play a role in prevention. Things like avoiding smoking and practicing safe sex can reduce your risk. Now let's talk about the human papillomavirus, or HPV. HPV is a common sexually transmitted infection. This virus is incredibly common, so common that most sexually active people will encounter it at some point. While many HPV infections clear up on their own, some types can lead to cervical cancer. Enter the HPV vaccine, a true game-changer in cancer prevention. This vaccine protects against the most dangerous strains of HPV that cause about 70% of cervical cancers. The best time to get vaccinated is before you're exposed to the virus, which is why it's recommended for girls and boys as early as age 9. But if you haven't had it yet, don't worry. It's still effective for adults up to age 45. Some people worry about the safety of the vaccine, but studies show it's extremely safe and effective. If you have questions, talk to your doctor to see if it's right for you. We've covered a lot today, from understanding cervical cancer to the power of prevention through pap smears and the HPV vaccine. Remember, knowledge is power. Talk to your healthcare provider about screenings and vaccinations, and encourage your loved ones to do the same. Together, we can reduce the impact of cervical cancer and save lives. Thanks for watching, and don't forget to hit that like button, subscribe, and share this video to spread awareness. Until next time, take care and stay informed.